your facilities by looking at a desktop. And this product goes even further. It measures social distancing. It also allows you to put COVID-19 updates out to folks. It's a web-enabled product, so people can watch it from their residences and see if they're able to get on property. And then it also allows for us to do contact tracing. So if someone were to become infected, we'd be able to use the data on the property along with our wireless access point and all video devices and be able to help with contact tracing. So we thought that we were getting into the internet business. What we found was we were getting into the opening of clubhouses and common areas across the country. So we think that this is a very good novel approach. It's very inexpensive. We send to the property a wireless access device that comes enabled with software for $199 a month. The software and the service are included. The installation is $499. Simple, and it can be installed in the week you order. So if you ordered today, we'd have it shipped down, and our installation, we have a national installation team, so we're able to do these things quickly. Last month, we turned on 30 properties, and it was their biggest month ever, 3 of which were community-wide Wi-Fi installations. So this was the purpose of our developing of the product in order to be able to help communities like yours create peace of mind to residents who don't know what to do. We think that the lawyers will like it. We think the insurance companies will like it. We think that the property management companies will like it. And we know that the residents will feel secure. So that's the opening of what Inspire has done. And we'd love to help you in any way we can. This is a difficult time, and it's not going away. It's going to be here for some time, and I think it's going to change the way that we use technology. Obviously, look at us on Zoom, everyone together, yet separate. But we need to be safe, and that's the key. And I think we need to instill an air of confidence in the residents that we serve with an element of safety that makes them feel comfortable. Because a lot of this anxiety that we're feeling is coming from the lack of tools. So this is a tool in the tool belt among many. And I want to thank you very much for allowing me to lead off and be here today. Thank you.
Thank you so much, John. That's great information. I'm going to move on to Jarad Pizzuti with SIHLE Insurance. He's going to be able to help you understand what your community liability would be during this time and if you decided to reopen.
Hey everyone, thanks Don, thanks Maya and Lynn for setting this up. Over the last week or so, since the legislation's come through that we're going to start reopening and everything, the timeline has kind of begun. The questions have been rolling in. So we've done quite a bit of research, lots of long Zoom calls with carrier reps and people in the other end of the insurance industry. And really what it's coming down to for us is mitigation and limiting risk. There have been no specific insurance requirements handed down by the individual carriers, meaning your policies as they stand today have not been changed or affected or amended in any way. One thing that may help calm the nerves when thinking about insurance and how it may affect you, it's a contract. It's an annual contract. What you signed up for at the beginning of that policy term is what you still have to this day. So you can rest assured that when reviewing your policy documents, what is there is still there. There's been nothing added or changed to your insurance contracts. So that's really helped people relax a little bit, relax their concerns a little bit. The question is, what exclusions existed when the policy term began? There's almost always a specific bacterial infection or bacterial exclusion. So diseases or infections and things caused by bacteria, on an unclean surface at a clubhouse, maybe gym equipment, or too many or too much or too little chemicals in a given pool. And bacteria is built up and that causes disease. typically that's going to be excluded from your normal general liability policy that a lot of your communities have in place. So that's one thing to look for. That isn't going to affect anything that has to do with COVID. That's something that's pre-COVID, and that hasn't changed since this whole ordeal has begun. So that being said, in short, there's been no new additions or exclusions added to your policy because it's a contract. It cannot be changed, okay? That being said, if you have a pollution policy in place, it would help cover that bacterial stuff. So with that said, all we're trying to do here is mitigate risk or limit the potential for our residents to become infected with this virus. And a lot of us have pools and things like that, and the questions have been coming pretty specific to different pool areas. So based on our research, I've got a couple different points that I want to hit real quick. I'm going to go kind of robot mode through them just so I can get in as much as I possibly can. So we're going to go swimming pools, exercise rooms, sport courts, spas, jacuzzis, docks and viewing areas, and clubhouses, okay? A lot of these overlap, and just so you know, I can send this information written to anyone who wants it after, because I am going to kind of go through all this quickly. Swimming pool areas, we recommend telling your residents that they must wear face masks when not in the water. We recommend that whoever is on site or whoever can be on site provide hand wipes, hand sanitizers. We would have you consider removing all of the pool furniture, but allowing residents to bring their own furniture. So what that does is give people an opportunity to spread themselves out and use their own best judgment. And if they don't bring chairs, too bad. It looks like you're standing. And that's also another a way to help deter, grouping and crowding. When there's chairs, people will take them and they'll make circles and, hang out with each other. And that's what we're trying to avoid. Obviously, recommend proper social distancing of 6 feet. We also recommend at any one of your pools or entrances to clubhouses posting restrictions such as virus warnings, all points of access with consistent messages of please be aware, as if everybody isn't aware of what's going on. But again, it's mitigation and it's passing liability off. That's the idea. Is if we put a warning out there, we're doing our best to let people know that, hey, this is still going on, and we've considered the potential consequences of reopening our pools. So signs and entries, warnings, restrict occupancy to maybe a quarter or half of what your typical occupancy is. If we've got a pool area that's suited for 50 people, let's cut that at least in half. And these are temporary rules that you can adopt without recourse. The board can adopt these temporary rules based on the current legislature and everything that's going on. We can adopt these without consequence, without pushback from the board. Exercise rooms and workout rooms, again, face masks. Again, let's be diligent with providing hand wipes, providing antibacterial creams and things like that. If you have the machines in the gym, please make sure they're full, okay? And going back to mitigation and passing off liability, just having taken these steps and having the antibacterial at the desk or in places that it might not normally be, with people maybe reminding guests, hey, please make sure to sanitize your hands before and after you come in here, wipe down the equipment, things like that. It's our on-site managers that we need to be more diligent with things like that. Tennis courts, pickleball courts, playgrounds, bocce ball courts, racquetball courts, things like that. These are a little more difficult to control. Similar to a pool, they're outdoors. People are sick and tired of being inside. I know I am. If I had a tennis court, racquetball court in my neighborhood, I'd be all over it. What we need to do is, again, restrict occupancy. If there's a 2v2 game going on tennis, those 4 folks are the only ones to be on the court. Everybody else, practice social distancing outside of the court, spectate on the other side of the fence. If we've got viewing areas and things like that with bleachers and stands and places that lend themselves to grouping and gathering and sitting closely together, our recommendation is to temporarily block those off. Either remove them if they're small bleachers, or let's see some caution tape with some warning signs, please no gathering, things like that around the bleacher. Spas and jacuzzis, saunas, things like that. This is a little bit tougher because inherently they're more confined space. You can't really social distance in a hot tub unless it's quite a large one. So again, cut that normal occupancy in half. If it's a 5-person hot tub, let's make it 2 folks in there at a time. 10, make it 5. Face masks still to be worn in the area outside of the water. Okay, if you're in the water, obviously probably gonna want to take it off, but once getting out, pop the mask back on. With the spas and pools, if you are an on-site manager, please try and be present. These rules and these mitigation techniques are much more effective if there is somebody there watching and not necessarily enforcing them, but just observing, because these are guidelines. These are not rules that are adopted by the governing documents per se. These are temporary rules, so there isn't really a way that you could technically enforce these per your governing documents as an association or a manager. So we just have to kind of give that message off of, we're in this together. Let's try and adhere to these same rules. And we all want to stay healthy, and we all want to see our pools and hot tubs opened up quicker, our sport courts and the like. And the more careful we are, the quicker we can reopen these sort of facilities. I would, for the next couple of weeks, at least 3 to 4 weeks, if we have committees, social committees, whether it's a recreation committee, dog park committee, the beautification committee, all of those groups, those in-person meetings need to remain suspended. If you can facilitate them online via Zoom or Skype or whatever service you may have available to you, do it that way. But let's still stay away from the on-site, in clubhouse, at the pool, committee or board meetings. Okay, we've got plenty of technology. We can facilitate these things either through conference call or Zoom calls, Teams, or one of these other services. So still stay away. You're going to get pushback from your committees and boards, but still stand your ground. This is one of the biggest issues because people want to meet. They want to get together, and they want to talk about how they're going to move forward, which they should want that. But you have to stand your ground and let them know, hey, we are willing as the manager to help you facilitate whatever meeting you would like to have. We just cannot do it in person. There's no official restriction. There's no way that you could officially enforce these items, but it's got to be that we're in this together mentality. And the more you try and help your board figure out how to use Zoom or how to set up a conference call, the easier it's going to be for you. Just try and jump out ahead of it if you can. In closing, I want to talk about just one very simple implication that's existing in your policies now. One thing to look for, there is an exclusion for expected or intended injury, meaning if you know that there's something going on that lends itself to potential injuries or there's an increased level of risk as far as people getting sick. I know Pat will probably jump on this a little bit later. From the attorney side, there's a lot of gray area because it says expected or intended injury. Obviously with how widespread the information is and the news coverage on all this is, everybody and their brother knows what's going on. So it could be, you could say that if somebody caught the virus at the pool, or somebody or a family or a bunch of people caught the virus at the pool, the association did know that there is an expected risk or injury. There is, but the wording of it is such that it is very gray. It's not cut and dry. It's not yes, you're on the hook, or no, you're on the hook. It's maybe, but it does not address viruses or communicable diseases of any kind like that. It states injury. So I point this out because it's the closest thing to an exclusion for something like what's going on right now, if that makes sense. So this will be included, so you can search for it in your policies in the document that Ascend will be sending out afterwards. And if anybody has any questions on what you're sent on the insurance side of things, please let me know. I'm sure Wynn and Maya would be more than happy to help you reach me. Thanks, guys.
Thank you so much, Jared. That was Very, very powerful information. I'm sure the CAMs are going to have a lot of questions, and board members are going to have a lot of questions for you once we get through all of our panelists. Please direct your questions to the Q&A rather than the chat. It allows for us to identify which questions have been answered, and that will help us track it so we make sure we get everybody's questions answered. Thank you so much, Jarad. We're going to move on to Kelsey Mcgary with SERVOPRO. She's going to identify some things that you're going to need to do as a sanitation for your clubhouses, your pools, and then also how SERVOPRO can help.
Hi, everyone. Thank you for joining us. Thank you, Lynn and Maya, for putting this on. Going off of what Jarad was saying, he had some really good points. I am not really sure, and this is just something I was thinking about the other day, if there was a way for a sort of virtual platform that you could use so that people could sign up for times to be in certain areas. The CDC is going to recommend that you keep it at 10 people per space. Obviously, it's going to be hard to manage that. So maybe if you had kind of like a virtual sign up sheet for like the gym, for pools, and then that way you could kind of make sure that it stays organized. It was just an idea I wanted to throw off going from that. But just to start for my presentation, I'm going to read some stuff directly from the CDC because it's really important that you know that this virus is new and that there's still a lot that we don't know about it, but this is what we know thus far. Also, before I get into this, please continue to wear your face masks yourself to encourage your community members to do that as well. When you go out in public, and wash your hands, avoid touching your face. We all have that, I have that problem, but so now on to the cleaning and applying disinfectant. This is directly from the CDC. Normal routine cleaning with soap and water will decrease how much of the virus is on surfaces and objects, which reduces the risk of exposure. Disinfection using EPA-approved disinfectants helps reduce the risk. So frequent disinfection of surfaces and objects touched by multiple people is important. And then regarding how long it stays on surfaces, current evidence suggests that COVID-19 may remain on surfaces made from a variety of materials for hours to days. Cleaning of visibly dirty surfaces followed by disinfection is the best practice measure for prevention of COVID-19 and other viral respiratory illnesses in community settings. As far as staying in the air, directly from the CDC, it is unknown how long the air inside a room occupied by someone confirmed with COVID-19 remains potentially infectious. So facilities will need to consider factors such as the size of the room, the ventilation system design, and location and supply of exhaust vents when deciding how to close off rooms or areas used by ill persons before beginning disinfection. Taking measures to improve ventilation in an area or room where someone was ill or suspected to be ill with COVID-19 will help shorten the time it takes respiratory droplets to be removed from the air. So basically, when your board is making the decision that they're ready to move into phase 1 and reopen, again, according to state guidelines, it's 10 people in the space. So before you do that, it is recommended that you clean the space and then you disinfect. Now, they're different, which I'm sure many of you know. You can actually do the cleaning yourself in your home, in your own homes, just with soap and water, especially on the high touch areas, fridge handles, doorknobs, light switches, just anything that's going to be touched frequently. And then you can go in and disinfect. You want to make sure that you get all the nooks and crannies. Just because of human error, it can be really hard to do that, which is why it's recommended that you do some kind of fogging or spraying, just because that does get all the nooks and the crannies. They're both important. Make sure you look at the label as well, because even in your own home, if you're about to clean and disinfect, if you don't leave your disinfectant on for the appropriate dwell time, it's basically pointless. And the dwell time is essentially how long you need to leave that disinfectant wet on the surface for it to do its job properly. So make sure you don't cut that short. Like say you use a Lysol wipe and then it dries and it hasn't been the correct dwell time, that doesn't really do a lot. So make sure you look at the label. It does vary from product to product. So by cleaning, you're actually removing the germs just with basic soap and water. You're disinfecting is killing the germs that are remaining. So bacteria, and there are a few studies that have shown that viruses might be able to do this too, can create something called a biofilm, which is basically a colony of bacteria. It's the grime that you see on handrails or at the base of the sink when you know that the basin of the sink needs to be washed. That icky feeling you get in your teeth when you know it's time to brush your teeth after eating a meal, that's all biofilm. And it's been shown that viruses might be able to create that as well, and not just bacteria. Either way, it's a sticky surface and a sticky substance, so you want to make sure that you are cleaning with soap and water because that will help remove that. And then once you go in and disinfect, that's going to give it it's the maximum amount of cleaning. It's really just going to lay the foundation so that you can clean and disinfect to the best of your ability and really kill the virus. So basically, all you really need to think about is if you're going to reopen, you need to clean and you need to disinfect. So, I mean, you can bring in a pro to do it. If you're going to bring in someone like SERVOPRO, if you're going to bring in anybody to disinfect, make sure they've been doing this for a while. And I say that because there are certain companies that have been recently offering this service that normally did not. They may not be certified. They might not be using the proper PPE. There's a lot to consider. So just research your company that you choose. Just be careful because there's a lot of scammers out there right now. As far as SERVOPRO, what our process is right now, it does depend on if it's a preemptive clean or a confirmed case. So basically we're going in with an airless sprayer to actually apply the disinfectant. It covers all the cubic feet, all the nooks and crannies. The product settles down onto materials. We leave it for the labeled dwell time. And that just assures that it's gonna be properly disinfected. So again, the dwell time is so important. And there's a lot of companies that will cut that down. I'm not gonna say names, but just, again, research who you use. So after you do the fogging or the spraying of your space, the disinfectant, you're gonna wanna go in again with an EPA approved disinfectant and go over those high touch areas again. So say you clean them with soap and water, then it's disinfected, and then you wanna just, to be thorough, go again with a disinfectant and wipe down those areas, the doorknobs, the fridge handles, the light switches, anything that's frequently touched. And also keep in mind, if you're touching these things, wash your hands in between. I know it seems excessive, but pretend that every time you touch a surface that's in public, you're leaving a grime on your hands and you need to get that grime off and as soon as possible if you're not wearing gloves. And I know they're in short supply, so it's kind of hard to come by them. Also, doggy bags, believe it or not, can actually be used for like when you need to go get gas. You can use that, put it over your hand, and then that way you don't have to touch the buttons or the pump directly. That's a good alternative if you can't find gloves. So basically you wanna make sure that your community knows that you're cleaning and disinfecting. It's going to make them feel safer. It's gonna help them have trust in you, that you're taking care of them. And you just wanna err on the side of caution because this virus is novel. It's an intense virus, so just make sure that you clean and disinfect before you reopen. And if anyone has any questions, they can, I'll drop my phone number in the chat, or Mia and Lynn, I'm sure, will I think they're on the website, but you can always call or text me if you have any questions. And that's all I have to say, unless there's any.
Thank you so much, Kelsey. Yes, and for everybody on here, we will be posting, along with the article, the recorded video, every panelist's contact information so that you can easily obtain that. And that will be listed on our articles page of our website. That's www.ascendme.org. And I'll post that in the chat and reiterate it at the end as well. Thank you so much, Kelsey. Very, very beneficial information for our CAMs. Next is Patrick with Becker and Polyakoff, and he is going to help you understand where we are right now and what your boards can and can't do, considering we are still in a state of an emergency.
Yes, hi everyone. Thanks, Maya. Just to segue from what Kelsey was talking about, she discussed the preemptive cleanings and then the cleanings that are done after a known case has been found. We are encouraging our associations for liability purposes to have one of those deep cleanings if it is determined that either a worker, someone on the management team, or an owner or guest has contacted the virus and advised the management company of that. So if that happens and you know that they have been to the mail kiosk or some area that has been that will be used by others, bring in a professional team for liability purposes and have that area cleaned, because later on if someone accuses the association or the management company of somehow allowing them to get the virus or transmit the virus, anything that you've done to prevent that is going to be evidence later on that everyone's going to be looking at. So it's money well spent. Bring them in, have them do a thorough cleaning. It's also going to make everyone feel better that, you know, the association is doing what they're supposed to do to keep the place clean. Preemptive cleanings are good as well. We're advising our clients to do those. So they're also a lot cheaper. So have those done on some sort of rolling basis when everything starts to reopen, all the more so. Have everything cleaned professionally, step it up with your on-site cleaning team, and then have every once in a while periodic preventative cleanings done as well until this is all behind us. If you can show as an association and as a management company that that you have taken these steps, it's going to help later if somebody does make an accusation against the association. So one of the questions that I saw that came up on the chat was, how would they prove that the virus was caught, you know, on site at the pool or at the mail kiosk or something like that? That's going to be on the part of the plaintiff. That's the plaintiff's job. That's the plaintiff's attorney's job. And we have seen that in other circumstances. You know, how do we know that the person slipped and fell in our parking lot and not somewhere else? You know, it's like, well, you know, that's going to be part of the thing they have to prove, but they're saying it. And as long as they say it, they can file a case and you're going to have to defend it and you're going to spend money on an attorney. So doing all of these preventative things and putting them in place are things that as a litigator, I want to see. You know, when a suit is filed, that's the first question I'm going to ask is, well, what have you all been doing to prevent this? What measures were in place? You know, give me your list. And I am going to love it if the property manager sends over, well, you know, we doubled the time that our on-site cleaning crew, you know, was spending on site. Instead of 2 hours on site once a week, now they're cleaning 6 hours, you know, twice a week. So that sort of stuff is going to be really helpful. You know, we brought in SERVOPRO to do preventative cleanings once every 2 weeks. That's going to be helpful for me in defending the case. So a lot of this is common sense. The other thing is, everyone's asking, you know, the state of Florida is opening back up. So can we open back up? Definitely following what the state is doing, state and local jurisdictions, is going to help you from a liability standpoint. So if the gyms are closed, your gym needs to be closed. If the state opens the gyms and has certain restrictions, every other machine has to be taped off and no more than 10 people in the gym at a time, and you know, all these other rules that come with that, follow those rules. Even though you're not a public gym, if you follow the mandate from the state, despite the fact that you may not absolutely be required to legally, that is going to protect the association later on. If there is an incident, there is a claim filed. I saw also a question that came in about posting rules. Heck yeah, post rules. You know, if you want people to only use every other lounge chair, say that in a rule and post it. Send it out to everybody with 14 days notice. Also, with reopening, it's going to help if the board will word it so that it's clear to everyone that something like a swimming pool is going to be reopened on a test basis, and that everyone understands that, you know, if social distancing is not followed, that the pool is going to be reclosed. So that will, I think, set expectations appropriately. And if something happens and, you know, as the on-site manager, you look out and there's basically a keg party by the pool, and it has to be closed again, you're going to have people understand that, you know, sorry, we opened the pool on a test basis to see if this can be done, and you know, proper social distancing was not followed. You can describe the incident, and reclose the pool if you have to. But you know, setting expectations is going to help later on with what people do. They'll also be on notice so that, you know, they'll understand that if they see improper activities and they want that pool to stay open, they're going to yell at the person, you know, next to them that's walking around without a mask on and doing things that they shouldn't do. What else? Clubhouse, restaurants. The same thing what Don talked about is going to be really helpful for using those different facilities. So from a liability standpoint, if you want to limit that, definitely talk to Don about that. That's going to be, I think, very, very helpful to assist you with reopening and reopening without incurring liability. So, you know, look into those tools. If you have on-site restaurants, obviously follow the same mandates that the state has put out. The 25% rule. The other thing that is important with the state mandates and the lifting of the state mandates is that there are the governor is allowing there to be stricter guidelines for communities, and so your local mayor may have something in place that is stricter than what the state of Florida is doing. So keep up with all of that. That's very, very important from a liability standpoint. Because if you're doing something that the state of Florida allows, but violates an executive order from your local county mayor or city mayor, and there's an incident, that's going to be problematic for you all later on. So keep those in mind as well. Swim at your own risk. You probably already have signs up that say that. Expand those rules, make them common sense. Somebody mentioned taking away the pool furniture. I think it was Jarad. I think that's a great idea, honestly. You know, now's the time to restrap your pool furniture, okay? So send it out, get it restrapped, and when people are complaining about where it is, you can tell them that it's being restrapped and cleaned and all of that. But they're going to be so happy the pool is open. They're probably going to understand that the pool chairs have been removed and whatnot. So keep that in mind. It's also going to I think cut down on people staying for a long period of time. You know, if there aren't a lot of pool chairs, they're going to bring their blanket, they're going to bring their towel, they're going to let their kids swim maybe for 30 minutes or 40 minutes, and they're going to go in. They're not going to set up, set up shop there for the next 5 hours because they've got chairs and they're super comfortable and all of that. Run the list of rules by your lawyer. They'll help you with those. So, that's one of those situations. Don't step over $1 to pick up a nickel. Let your lawyer spend 30 minutes looking at your list of rules and help you with those so that they can offer advice and get those rules exactly where they need to be. I think that's it from a legal standpoint. We had this presentation before. I went over all of the provisions in 720 and 718 that allow you to close different amenities. Those are still in place. We still have guidance that says, if you feel the need to close pools, close them. So you're still entitled to do that under both Chapter 720, the HOA Act, and Chapter 718. So if you don't feel comfortable with any of this and you want to keep things closed, know that you have backup under Florida law to do that. Thanks, everybody.
Thank you so much, Patrick. And to touch on Patrick's last comment, that article that Patrick had written in regards to what can and can't be done during COVID-19 state of emergency is also on the Ascend website within our articles tab. And the webinar that he's speaking about as well is also posted on our website if you want to watch that live. I'm going to go ahead and mute all of our panelists unmute all of our panelists so that we can start our Q&A session. And I have quite a few questions for everybody. So let me start with the first one from Jamie. Let's see, that's a webinar. Betsy, software questions for Don Johnson. What privacy issues do you see with monitoring the members of the association, Big Brother?
We get this question often. We don't divulge any information. We're already under contract not to do so. Highly illegal. What we do have is we have access to IP addresses for those who log on to the Wi-Fi network. Those that do not, we don't have access to their IP. We just know that their Bluetooth device is on site. We know how many people there are. We automatically alert management of any type of violation of the numbers of people that can come in. We have a waiting list you can sign up to and be able to reserve your time in the fitness center, reserve your time elsewhere, and things of that nature. So we don't share any information with anyone. All cable operators, internet companies, companies that deal in this technology are bound by federal law.
Perfect. Thank you so much, Don. I believe this question is for either Patrick or Jarad from Susan Clow. Her question is, would it be best to have limited access to opening everything up? Sterile cleaning first and then limited access or limited hours?
I think I covered that. I think Pat did as well. That question might have come in a little early. But yes, of course, we're recommending doubling the cleaning procedures. So if it's 2 times a day, bathrooms and hard surfaces and things like that, double that cleaning schedule prior to opening and then post-closing. Limited access. If it's a pool that facilitates 50 people, let's limit that to at least half or 25. If it's a smaller pool that allows access to 20 people, cut that in half and make it 10. And to further mitigate any risk of gathering or being too close to each other and things like that, either cut the deck seating in half or remove it altogether. I like Pat's recommendation. If you've got some maintenance you need to do on your deck seating and things, cleaning, restrapping, just get it done now. That'd be the perfect setup. You have a good excuse. You have 2 good excuses.
Awesome. Thanks so much, Jarad. Question from Beth. Are the products, and this is for Kelsey, are there products out there, you mentioned washing with soap and water and disinfecting. Are there products out there that do both at the same time?
I wouldn't try to do both at the same time. Mostly the purpose for the soap and water is to remove, like I said, like the biofilm and the grime and just anything built up on the surface. And then the disinfectant is to go and kill anything that's remaining. So I wouldn't, if there was a kind of like shampoo, conditioner, all in one product, I wouldn't do it. And I don't think there's any, I mean, we use hospital grade products, so I'm not really sure of any that would do both effectively. I wouldn't recommend it. I would just clean with basic soap and water first if you can. Even if you didn't clean with soap and water first, the disinfectant would still do a great job. It's just that helps to really maximize by removing just the soap and water. Just, it's simple, but it's really effective at removing grime and sticky substances that nasty stuff can stick to. So I wouldn't recommend that.
Okay. Thanks so much, Kelsey. Another question for you from Doug. He states, I believe guidelines indicate that the areas that have been closed for greater than 7 days do not need disinfected. What are your thoughts on that?
Honestly, it's really possible that's true. I mean, it's a novel virus. It's kind of hard to tell how long it's going to stay on surfaces. But it's thought to be that it's days. So if your facility has been empty for a really long time, no one's been in it, and no one's been touching anything, then it's possible that there's nothing to worry about on the surfaces anymore. It is important to know, though, that as soon as people start coming into these spaces again, there's potential of it getting infected again. Like literally one person could come in with the symptoms or be asymptomatic still and not actually be displaying the symptoms and infect it. So that's why it's important to do cleaning and disinfecting frequently, because say it's been empty for a long time, great, it's been empty. As soon as people start coming in again, that's when it's, that's when it gets dodgy, because it could get disinfected again very easily if someone comes in with the symptoms. So it's up to you, honestly, and what you want to do. If you want to just plan the safe side and get it disinfected, I still recommend getting it done before having people come into the space, just to be safe, just because this virus is so new.
Thank you, Kelsey. Susan has a question, and I believe this is probably for really anyone who wants to answer. Should we require wearing masks in the mailbox area? It is a small area and somewhat enclosed.
I would limit access. So it's tough to do because if you're not on site, you can't control that. But what you can do is put a clearly visible sign with bright letters and kind of create an honor system, if you will. Please make sure that only 1 or 2 people, or however big the place is, to keep 6 feet of distance. Please limit your own access. So if somebody's in front of you, let them go in, handle their business, let them leave, and then go in. I found that the masks, it's harder to enforce than access control. So I would focus my efforts on the access control and getting good signs on the doors.
Mm-hmm. Yeah, and just to play off of that, Jarad, and what Patrick said earlier, just, posting a sign out front and allowing your homeowners and members to govern themselves, because there's no way that a CAM is going to be able to stand at the mailbox area and do door count. So
right.
Unless you get the Inspire with Don Johnson paradigm, there's no way for you to police that. So just posting common sense signage so that everyone knows the expectation and can follow it.
Yeah, absolutely. And the other part of this is if you develop some criteria, you develop a sign, and you've seen this in the checkout lines at the grocery stores. They have the X's: stand here, stand here, stand here. You could do the same thing at your mail kiosk or mail building, where people are lined up and waiting to get in. The other thing that it does by having these signs and having these rules and having the X marks the spot, stand here, is that it empowers the owners that are following the rules to you know, holler at the folks that aren't, you know, say, I'm sorry, you know, will you please follow the rules here and stand behind me? You know, you're on me like a backpack, so get back. So, you know, if you do these things, then it's going to empower people that want to follow the rules to, you know, insist on it being done, to the people that maybe just are a little more clueless.
Perfect. Thank you, Patrick. To touch back on kind of that same similar topic, Heather Dean asks, does the capacity of the pool limit the number of people, or is it 10-person rule no matter what?
The 10-person rule, Pat can help me out on this one. I think it varies between different local governments. But within the association, that's kind of your realm. So you can adopt whatever you think is practical. If we have a pool that has heavy traffic and it can facilitate 100 people, it doesn't mean that we want 50 people in there. It's going to be a judgment call. You know, if we've got 50 people in there and they all know each other and they're from the same group and they're sitting in the same area, that's still a problem. So it's got to be case by case, you know, based on what you know about your community and your experience in the common areas. But it's going to be experimental at first. You know, it's not going to be perfect right off the bat. If you if you limit the access to 50% of the normal occupancy and you find that it hasn't been affected, you know, maybe you need to adjust that down to 25. And you know, saying this out loud now, I just had a thought, you know, when we're posting rules and things, you know, maybe just to cover your butts a little bit more, you know, mention in the rules that these are subject to change. You know, we're figuring this out to keep y'all safe. Maybe just put that precursor in there, say it out front. These rules are subject to change. We're figuring out what best practices are during this time. So maybe put that out front to help you on the back end if you do have to adjust the limit down from, say, 50% to 25% if 50 isn't cutting it.
Can I pipe in on that real quick too? Just with like the pool spaces. Am I on mute? No, I'm not. Okay, good. It might be good to do something like where you have in your pool space, because it's a bigger space, like in a gym, for instance, obviously, I mean, unless you have a huge gym, it's going to be a tighter space than, say, a pool. So if you're looking at your pool space, you decide on how many people with your own discretion that you're going to allow in the pool at one time. Maybe you can have like separate areas that you mark off, like this is your space, this is this group space, this is group space, please stay within this boundary. And then that way people will know that they can't, like families can gather, but then other people can't gather together. If that makes sense. Just an idea.
It definitely does, Kelsey. A couple questions for you, Kelsey, from Carl Thompson. Are there disinfecting wipes or cleaning products that SERVOPRO will sell that you have on sale?
No, we keep all of we have the disinfectant that we use is hospital grade, and to actually do these cleanings, we go in and well, I don't, but my awesome crew goes in with full PPE and depending on the situation, if it's a confirmed or suspected case, it's, you know, full mask, respirator, and the whole shebang. But if it's just like a proactive, preemptive case, they're still going to go in with the Tyvek suit, but they know how to handle this disinfectant, and we don't sell it. We keep it for the spaces that we're trying to clean all over Orlando. And I know it can be kind of hard to find good cleaning stuff right now. I mean, for your own homes and everything, you know, bleach and water can work. They have a really long dwell time, but I would, you know, the cleaning part you can do on your own pretty easily. It's the disinfecting part where you want to be careful, because you want to get all the spaces, horizontal, vertical, in between. So if you're going to do it on your own, just make sure that you use the appropriate dwell time of whatever disinfectant you're using. And like I said, bleach and water isn't, you know, it's not, I don't even use Lysol wipes, honestly, guys, because they dry so quickly. Like, I get the spray because it can actually sit and saturate, and it doesn't, dry super fast. And then I'm sure that the dwell time is complete. So that's just something I do personally in my own home.
Perfect. Thank you, Kelsey. Another question in regards to that very same topic. Since disinfectant sprays and disinfectant wipes are so hard to come by right now, what can they use in lieu of those two items, if anything?
I'd say bleach and water. I mean, that'll it'll work. You just have to make sure. I'm not sure what the dwell time is with bleach and water. I know it's got to be 90% water, 10% bleach. I think it's something around like 10 to 20 minutes to leave it on. So it's definitely more of a task. But I haven't really been to the grocery store in a while, but I'm not sure if bleach is hard to come by right now. So if it is, I apologize for giving that suggestion, but
if it's okay with you, Kelsey, can you guys hear me? Or am I freezing again?
You're good right now, Lynn.
Okay. I just wanted to add something because you guys know I work for Stratus now, but I did work for SERVOPRO in the past. And actually prior to that, I worked with Frances, who hosted our first webinar on COVID, and she's an infection control specialist. And if you're having difficulties finding the bleach, vinegar is a really good disinfectant. I actually found some at Publix and wanted to share that with you guys, but it was in the cleaning section. They make now a vinegar that's lemon scented and for cleaning, but it's vinegar, white vinegar, apple cider vinegar. White vinegar is usually used for cleaner, but you can use apple cider vinegar. Hydrogen peroxide is excellent at killing viruses and germs. Again, harder to find. But I'm sure that Kelsey can also do some research with her team and find out if there's any other products out there that they would recommend that maybe people don't know about, and reach out. But I wanted to share that with you guys.
Thank you, Lynn, for helping out with that question. I have a question that came through an email earlier today from Roxy. She wants to know, and this would be a question for Patrick, there are federal, state, county orders and CDC orders. Which one takes precedent? For example, the CDC indicates pools are okay. The state EO permits the broad term swimming with no differentiation for public, private, beaches, lakes, and etc. And the Orange County EO that she could find lists pools, again, with no differentiation. So which should associations really be following?
Well, it's sort of an all of the above approach. Whichever one is the most restrictive that governs that governs your community. So if the community that you're talking about is in Orange County, and Orange County has a stricter rule in place than the state or even the CDC, then you need to follow that Orange County executive order. So the Governor DeSantis has made it very clear that he's going to allow local mayors to issue executive orders that are stricter. So you need to look at those. The other thing with that is, there may be some argument about whether a private pool is governed by the same executive order as a public pool. And this could apply to anything, your clubhouse or some other recreational area. But the point is that if the state or the locality has issued an executive order that covers something and says, don't go to the gym, the gyms are closed right now, and you're sitting there and you're trying to sort of split words and say, well, I don't know if this applies to us, so we're going to open our gym. The point is that there's been someone with authority that's issued guidance. And if you disregard that and say we're opening the gym, that exposes you to liability. So later on, if someone gets sick and there's a problem, that's the evidence that's going to be used against the state of Florida. The governor had said to close all gyms, and you open the gym. Why is that? And you're going to be in the deposition or on the stand at trial answering that question. And what's a good answer? What's a good reply to that? Well, technically, I was able to open it. No, you know, the jury's you're gonna get destroyed. So, you know, just look at it like that. You know, don't look at technicalities, look at keeping people safe. And if you do that, you're going to be just fine in this.
Perfect. Thank you so much. One last question, I think. I mean, and if you guys have questions, by all means, let us know. Enter your question in the Q&A section. Don, this question was from you. It was from earlier. How does your device connect, and what does it connect to?
Oh, great question. So most community centers already have an internet connection with someone like Spectrum or Comcast or AT&T or CenturyLink. We would connect right into your current broadband connection. If you don't have one, we will supply one. And literally, we install an Ethernet cable to the wireless access device, which goes into a ceiling location that we choose. There may be multiple per property, depending on how large the community center is. Fitness room, things like that. We can create zones with that. So that's how we connect. So there's no increased cost to the association for anything having to do with bandwidth. The only thing that would cost more money would be the subscription to our service, which is $199.
Perfect. Thank you so much, Don. And to kind of elaborate on Don's new device, I'm fairly excited about it. Going further beyond COVID-19, he had talked to us a little bit about how it would work and the heat signatures in the event of an active shooter. And he's going to elaborate on that in a different webinar, so stay tuned for our emails. We're going to be posting a lot of content in terms of what's going to be available for you right now, CEU webinars, different panel discussions, and virtual happy hours. So definitely make sure that you're getting our emails. If you're not getting our emails, let Lynn or I know. I believe Lynn has a couple things she wants to say if we don't have any more questions from our attendees.
Yeah, there's a few things I wanted to add. Thank you. Sorry I froze up earlier. Haven't seen you guys in so long. We miss you. Looking forward to the day that we can start offering our luncheons again. And trust me, we are constantly brainstorming. Maya and I are brainstorming with one another. We're brainstorming with our advisors. And we want to make sure that it's safe for everybody before we do that. And obviously the restaurants have to have the capacity. We're weighing out different ways and different ideas. But as Maya said, in the meantime, we're offering the CEU webinars, educational non-CEU webinars that are very helpful. We're also doing the panels. I wanted to talk briefly about the virtual happy hours. If you are part of a management company that has multiple CAMs, we would let us know if you're interested in a virtual happy hour. It's going to be a lot of fun. We hand deliver some really great goodies. Ring the doorbell with the elbow, stand back with a mask on, so you don't have to worry about getting infected. But and then we set up some fun things to do with activities and just kind of mingling and getting to know one another again. So if you're a management company out there, part of a management company, and you and some of your coworkers would like to participate in this, please reach out to Maya or myself. I did want to add another thing though. You know, somebody had asked Kelsey earlier about our place has been sitting there for a month or more, 40, 50 days. Do we really need to clean and disinfect before we open it up to the public? And my personal recommendation is yes. And I kind of go off piggyback on what Patrick said. You know, you do it before it opens. You schedule a strong disinfecting, you know, you clean all the time, but schedule a professional to come in and do disinfecting once every couple of weeks. Like Patrick said, this is going to help if there is somebody that's, you know, if somebody walks into a room with COVID, yeah, and then you got it in there again. But if you're doing everything that you can as an association to show that you are doing everything you can, it's going to help with your legal case. And I'm glad you brought that up, Patrick. I think that was an eye opener for myself and Pat and Jarad's list. We're going to be posting that on our website, but it's a great list. I think you guys should all take a close look at it. Thank you, Jarad, for sharing that with everyone. And Don, the fact that I keep freezing up all the time, you and I need to talk about internet.
And I was going to say, if in this unprecedented time, we've got a lot of pressure on the networks residentially. Everything that was in the business sphere is now in the residential sphere. The time to look at your networks, its capacity, whether you have copper, whether you have fiber, is now. It's not going to get better as time goes on. It doesn't self-heal. So I'd be happy to help anyone. Absolutely.
Awesome, John. I do have one more question that came in. It seemed a very important question, I think, as well for Patrick. Do we need to mail a 14-day notice for the temporary rule changes?
You do not. So both 718 and 720 have emergency provisions that suspend the notice requirements for both member meetings, board meetings. That would also apply to a board meeting where a rule adoption is going to be addressed. So normally it's a board meeting with 14 days written notice to all the owners where a rule is going to be discussed and implemented or changed. So that is suspended. It says that you can give notice as is practicable. That's what both of the statutes say under these emergency provisions. And so if you post it and you email it out to everybody that you've got the email address for, and then immediately implement it, that's going to be okay. So there is no judge that's going to wrap you on the knuckles for implementing these things that are related to the health and safety of your owners. So don't worry about that.
Thank you so much, everybody. I want to reiterate Kelsey Mcgary with SERVOPRO, Lynn Sadowski with Stratus Roofing, Patrick Howell with Becker and Polyakoff, Jarad Pizzuti with SIHLE Insurance Group, and Don Johnson with Paradigm Broadband Group. And again, I'm going to post everybody's contact information on the website so you can reach out to them if you have further questions. I'm sure you do. And thank you guys so much. This is a very educational, very informative panel that I think will weaponize our community leaders to put together a really great protocol in order to open their associations back up. So thank you again so much, everybody.
Thank you. And just so you know, my phone took a swim yesterday. So if anyone needs to contact me, please stick to email. I should have a new phone in the next couple of hours.
Thanks, Jarad. I'll definitely post your email address on there then.
Thanks everybody for joining us today. We miss you from Ascend and look forward to seeing everyone again. And if you have any questions, like Maya said, feel free to reach out. Thank you.
Thanks, everybody. Have a great week.
Bye, everyone.
Bye-bye.
Stay safe.